All right. Well, I think we might get started then. So I'm hoping everyone can hear me okay. Just having some issues on our end on microphones. So my name's David L. I'm joined with Yelena. We're both from Adelaide Primary Health Network. And we are supporting community health organisations to get registered and actively use My Health Record. So we are joined by Samar from the Australian Digital Health Agency, who is in the education team there. So she'll be running through the, I suppose, the why we want to use My Health Record and how it's going to benefit you, but also how to register as well. So I'll hand it across to you, Samar.
Okay, thank you very much, and thank you to those joining us today. Just put up the relevant screen. There we go. So hopefully that's visible to everyone there. So yes, my name is Sama. I'm from the Australian Digital Health Agency. So before we get started, I'd like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea, and community. I'd also like to pay my respects to them and their cultures, and to elders both past, present, and emerging. So what is My Health Record that I'm sure you've all heard lots about? Some of you may have engaged with your own My Health Record. Essentially, My Health Record, it's an online summary of an individual's key health information. So we do stress that it is a summary. It's not designed to be a complete record or to replace any existing records, but more also to be used as a complementary source of information along with information that's already held in a system. We do have about 23 million Australians that have a My Health Record, so that's about 9 in 10. And it is completely up to the individual whether or not they have a My Health Record. So they can decide if they have one, what's in their record, and who can access their record as well. And that's a key feature of the system, that whole personal control. It's also part of a national system, and it's accessible at all times. So anywhere they are within the nation, so they could be traveling interstate, visiting family or friends, or they might not be traveling, but they might not just be near their primary healthcare provider. For example, it might be like an after hours situation. Their health information will follow them wherever they are. So it's accessible, at the point of care, and also during an emergency when, in a lot of the cases, an emergency is never planned. So in an emergency, again, that's information that your clinicians will have available to help support earlier diagnosis and just better management of your condition overall. And then also, given the sensitive nature of the information within a person's My Health Record, it is heavily protected. So we do have legislation in place that supports or protects My Health Record. And I will be touching on security a little bit more later on. So again, just to give you a figure of where we're at in terms of use across the nation, engagement with the system. So we have seen these numbers consistently increasing, which is great to see. So we have 99% of pharmacies that are actively using the My Health Record system. So they're uploading dispense records to that system. We have 95% of GP practices. So again, in terms of putting the prescription records up there or with shared health summaries. And then we also have significant engagement with the public hospital system. And we do have engagement with the private hospitals as well as specialists in aged care. That's a space we're continuing to see engagement there as well. And just ideally, the more engagement we have with the system, the more information becomes available, and the more information that can be shared, across the healthcare setting. So just to touch on the registration process, so this will pretty much highlight what's involved. One of the key things to have in mind, or to get organized before you even register for the My Health Record system, is for the organization to establish a security and access policy. So this is also consistent with the legislation. So the My Health Record Act, there's a rule in there that states that a healthcare provider organization needs to have communicate and enforce a written policy about how people will be accessing the system. So this is the security and access policy. And as part of that legislation as well, this policy can be requested at any time by the system operator, and the system operator is the Australian Digital Health Agency. So this policy, at a minimum, it's reviewed annually, and it is version controlled, because again, you could be asked for, your most current version or a version at a particular point in time. But that's generally one of the key things that you would need to have done before you connect to the system. And within that policy, you also outline how the organization will be accessing the system, because as we'll see later on, there are more than one ways of access, and training is also a requirement that you need to declare in that policy, again, before anyone is then using the system. So again, if we just take it a step back, so who's going to be creating this particular policy? Well, there are two key roles that the organization will need to establish in order to then create that policy and then register the organization. So these two key roles, so essentially they we determined early on, but they can change later if staffing changes. But these two key roles are the responsible officer and the organization maintenance officer. So we also refer to them as RO or OMO. So essentially with the RO, this person oversees the organization's legal compliance with the My Health Record system. So this would be the person that's going to register the organization and deal with any significant registration changes. Ideally, this would be, for example, the owner of the organization or the CEO, anyone who has an authority to act on behalf of the organization. And this person is also the person that can either add or remove OMOs, as well as the HPIIs, which is the healthcare provider, the users. So next, the OMO. Now, the RO and the OMO can be the same person, again, depending on the organization. And also a business can have more than one OMO. Sometimes, that's a good benefit in terms of, you have a lot of, I guess, like experts or in-house experts that people can, ask questions to if needed. But basically, this person is going to deal with the day-to-day dealings with the system, making sure that the policy, for example, is being implemented and the organization is compliant. So here, what I wanted to share with you here is, in terms of when you're setting up your policy, there are certain templates that are available online, which I've linked here for you to refer to. But again, an organization can create their own policy. But that's just wanted to have that there for reference in case you needed it. And again, just a reminder there that should be reviewed at least annually, but there are instances where you might just decide to renew it more frequently, and that's okay as well. And again, that would be dependent on the organization. So this here is an overview of the steps required for the registration. So it is a multi-step process, not usually done in a day, it would be a few days. So essentially, you would start off with the organization having a PRODA account, and then from there, that account will have to be linked to HPOS. So HPOS is what allows you to access sort of the secure government services. Next, you would need to register the organization with the HI service. And then, so that's that step 2. And then after that, you can see it branches out, and this is depends on how your organization is going to access the system. So they can choose one way or more than one way, but essentially if they're accessing through the national provider portal, then all that's needed to be done there is within PRODA, the organization's PRODA, they would need to link the users to the organization. Now, if the organization is accessing through conformant software, which is ideal in terms of with, and I will explain, we'll touch on this a bit later on, but through conformant software, there is, I guess, more functionality. The provider portal is a view-only platform. So, and which is why with clinical software or conformant software, there is a few more steps involved, as you can see there, which is downloading a NASH certificate, as well as a Medicare PKI. And this is something your software providers can help you out with. But essentially, when it comes to the registration process as a whole, also it's a great opportunity here to reach out to your PHN where they can definitely guide you through the registration process. So you're definitely not alone in this matter at all. As well, what I've said here is we have links to, again, fact sheets, just with step-by-step instructions, again, just to guide you through the registration process as well. Okay, so now just to touch on accessing the system, one thing we do get asked quite a lot is if you need permission from an individual person to view their My Health record. So the short answer to that is, again, it's mentioned in the legislation that as long as a healthcare provider is an authorized user of the system and the organization that they're accessing the record from is registered with the system, then they are able to access a person's My Health record for the purpose of providing care. So this could be, right at the point of care, it could be just before or just after the episode of care. But as long as that, you are providing care to this person, then you do have the authority to access their record. Now, there are instances where a person might have restrictions on their record, in which case you would need to ask for access. These instances, it's not a lot. We have about 2 in 1,000 people that have these restrictions, but that's one thing to keep in mind. And again, we will be touching on these restrictions a bit later on. But essentially, yeah, so you can definitely view that at any time, but also an organization that is connected to the My Health record system is certainly under no obligation to access the system for every single patient that they see. So it is, of course, case by case, it depends on, whether or not you need information. Basically, we just want the healthcare providers to be aware that it's an additional tool that is available that previously wasn't in the instance where they might need that information. So here we can capture the ways that a provider and patients can access the system. So what you can see on the left-hand side there, so in order to view a person's My Health record, you can access My Health record through the National Provider Portal, which we just mentioned, then through conformance software. And then for those that are in hospital, there's hospital applications as well that are configured to access My Health record. Now you're able to view and upload. Now I do understand that with community health organizations, the functionality to upload is not yet there, but it is something that's looking to be implemented early next year. But just to remind you that you cannot upload through the National Provider Portal. You can only view through the National Provider Portal, but through hospital applications and conformance software, you can upload as well. And then on the right-hand side, we can see how a patient can access their My Health record. So they can access their record through MyGov, and this is where they can upload. So, they can upload personal health notes, they can upload an advanced care plan, all through MyGov. And then they can also there's apps that are available now where they can install this on their phone, again, to have access to their My Health record. But these apps, like the National Provider Portal, are just for view-only purposes. But again, these apps do protect the information in there. They can't share the information with any third parties. So again, security is not compromised in that instance. So here I have an example of how you can access My Health record through Mastercare. I'm not sure how clear that is here, but I can zoom in here. There is a My Health record tab at the top there as well. Now, again, just making sure that before you access My Health record through Mastercare, that you have done the training, that you've been delegated as an authorized user within that organization, and that you're providing care to that patient before you access their record. Now here is an example of accessing My Health record through the National Provider Portal. So key thing to note here is with Mastercare, access through there, it's, My Health record is integrated in Mastercare, whereas when you're accessing through the National Provider Portal, you will be accessing this through a browser. So just any web browser, so you don't have to install any software. You will just need to access a web browser, then you would need to log in using your PRODA details. So that would mean the user would need to have an individual PRODA account. So PRODA being a provider digital access. And this PRODA account follows the person throughout their career. So you have one account, and even if you were to change organizations, it does follow you. It won't expire. Once you've logged into the National Provider Portal, this is the landing page that you will be met with. So essentially, it's called the Health Record Overview, which is the landing page. You can navigate your way through the record using this sort of panel along the top there. What we also have is sort of quick access sections just right under the heading there. So for example, how to quickly access allergy information, just there on the right. And then if we just move down, across here. So this section here is what appears when you've scrolled all the way down to the bottom. And again, you're able to access particular sections in here. Just more than one way to access the information. Basically, the bulk of the documents you might be accessing, for example, might be that second tab, clinical documents, but then it might also be, we have pretty much like a dedicated tab just to make it easy to access information. So this immunization records tab that you can see there, the fourth one across, that was added early this year, again, just to make it really sort of obvious where to find that sort of information. Okay, so now again, just to have a closer look at the information that you find within a person's My Health record. So what we have here is a picture that sort of captures the three main sources of information that will be located in a person's My Health record. So again, on the left-hand side, you can see the consumer documents. So, as I mentioned, it's personally controlled. So a person can just as, actively be engaged in their My Health record. But also for those that, are worried or are worried about sort of being responsible for their record, there is no requirement. So you can have a My Health record and not add to it and just sort of rely on the healthcare providers to add to it. That's okay as well. But yeah, so the consumer documents, they can add, for example, the personal health notes, emergency information, advanced care documents, which is really important for helping to communicate, end of life care. Then we have documents coming from Medicare. So any Medicare services that have been claimed, information from the Australian Immunisation Register and the Australian Organ Donor Register. And then on the right-hand side is the provider documents. So this will be the bulk of information that you'll see in there. And then what we have in the middle there, so there's 5 circles in the middle. These are overviews. And now these aren't uploaded by any particular person or organization. These overviews are generated by the system, and it's using the information that's already in the system. So for example, we have, actually we will be seeing an example really soon. First document to share with you here is a shared health summary. So in a lot of cases, this might be one of the first documents a person might access in a person's My Health record. Because it's a really fast and effective way to obtain information about a person. So essentially, it's like a snapshot of a person's health status at a particular point in time. And if anything was to change, then that would then prompt the need for a new shared health summary to be uploaded. But in this shared health summary, as you can see outlined in red here, these are the 4 key areas that this document will cover. So that's adverse reactions, medications, medical history, and immunizations. And then that bottom section, at the very bottom, this is what we refer to as the sort of administration section. This is where you can see the details of the person who authored that particular document. And again, this will be a way to then, so that you're able to contact them if you need, instead of having to rely on, for example, asking the patient or looking up their contact details. That will be in that document. With the shared health summary, this will be uploaded by the person's primary healthcare provider. So the person that they see the most. Now, this could be a GP, it might be an oncologist in some cases, if that's someone they see more regularly. But again, this will give any person accessing this document, this will give them an idea of who's involved in that person's care. So while not anyone can upload a shared health summary, it needs to be someone who's, like I said, a primary provider. So while not anyone can upload, anyone can view this particular document. So another kind of document here is we have the event summary. So again, at this point in time, it's just to view for community health organizations, but this is a document that once upload functionality is active, this is something that you can definitely take advantage of. These documents can be uploaded by any healthcare provider, so it doesn't have to be the primary healthcare provider. And essentially, it's there to communicate information that's relevant to the person's ongoing care. So it could be, for example, a clinical intervention, it can be an allergy. The type of events in these documents will vary depending on the healthcare setting. So physiotherapists might use it to document goals of their treatment. A speech therapist, again, might communicate the person's their requirements for their food. So again, very versatile there. And at the bottom as well, you have that same section there to relay who authored that particular document. Now this one here, this is one of those views. So one of the those 5 circles that we saw in the middle of the previous slide, this is a view that's generated by the system. So, and again, this was a recent enhancement that happened to support the COVID vaccination rollout. So about, I think May this year. So what we have here, again, we have 4 key areas in this document that to help you navigate your way through it. So the default setting there is the Australian Immunisation Register. So any information that's available on your Australian Immunisation Register is able to flow through to your My Health record. Then we also have the person's vaccination status. So again, COVID vaccination status, as well as their national immunisation program status. In the second tab, immunisations, this will cover immunisations that are from air, but also some that may not have been in air, but may have been in another document in a person's My Health record. And this is because it wasn't mandatory for vaccinators to upload vaccinations to air prior to this year. So that's why you might not see something in the first tab, but it might appear in that second tab. And then again, in that third and fourth tab, it just links you to documents that have immunisation information there as well. Now this here, again, a really useful overview. So a very similar format to that previous one we just saw with the immunisation information. Now what you can see on the left-hand side here are all the different individual documents where you might be able to source medicines information. So for example, a dispense record, a discharge summary, a pharmacist shared medicines list, lots of different documents. But again, we're all about, reducing the administrative burden. So instead of a clinician having to look at, 10 different documents containing medicines information, all the information within these documents is consolidated in this medicines view. So one of those views generated by the system. And then again, this view has 4 key areas at the top there. So it has allergy information. So again, a quick way for you to source allergy information, which again can really help reduce any medication misadventure. Then we have that next section there, which is the medicines preview. So again, you can sort all the person's medication by active ingredient or even by brand. And then again, we have a link to the person's most recent shared health summary, which was one of those first documents that we saw. Here again, just to highlight what the pathology report overview will look like. So again, it can get grouped by, as you can see on the right-hand side here, by the test name, or also by the organization. And again, you will just need to click on the hyperlink to access the actual report itself. One thing to note here is there is a 7-day sort of lockout period that applies where once a report has been uploaded or a diagnostic imaging, so either a pathology or a diagnostic imaging report, once they have been uploaded to the person's My Health record, there is a 7-day period where the clinicians have exclusive access to those results and not the consumer. And then the consumer can access those results after the 7 days. And that's just to give the organization time to, follow up and organize another appointment if needed. So not to spend too much time on this, we all know what a discharge summary looks like. But again, just to highlight here that now the hospitals have that opportunity to, as an additional measure, upload the discharge summary to the person's My Health record, as opposed to having to rely, for example, on a fax, which we still see happen quite a lot. Here, the Medicare overview. So again, another view generated by the system. What you can see here is what that will look like. So it has the RPBS and PBS information there. Then we have the Australian Immunisation Register information, as well as the Australian organ donor person's just their status. Just you can view their status. You can't like set their status using My Health record. And then that last section there, which we've blown up on the right hand side, is where you can see their Medicare services. So for community health organizations, again, this view can help you determine when a Medicare service has been claimed, when they might next be eligible for a particular plan, for example, and again gives you an indication of who else is involved in that person's care. So I've touched on already that the advanced care plan can be accessed through a person's My Health record. A key thing to note here is this is uploaded by the consumer themselves. So that's why, again, the healthcare provider is encouraged to have that conversation with them to encourage them to upload this document. What we have on the right-hand side is a goals of care document. This is like a subtype of an advanced care plan. These ones are uploaded by the hospitals. We have, for example, in Western Australia, this is widely practiced in the hospitals there. But just to emphasize here that the advanced care directive on the left-hand side is uploaded by the person themselves. And again, this is done through MyGov. So just to touch on a little bit more about the privacy and security, it's a genuine concern for a lot of people, and of course, understandable. So in terms of the security, we have a cybersecurity center at the agency that monitors the system 24/7. So and there's audit logs involved with the My Health record. So any unauthorized access to the system can be picked up. We also have, firewalls in place, security measures such as a person that's accessing or within an organization when users are accessing the My Health record system, they are encouraged to all have their own separate logins for the system. If there's ever any potential or actual breach to the system, then accounts are deactivated. If needed, new accounts are created. So lots of measures in place there. And again, these are all outlined in the security and access policy, what you would do in the instance of, for example, a password being leaked. And then also there are penalties that are associated with misuse of the system. So this can involve, like a financial penalty or even criminal activity, which is associated with jail time. And in terms of before a system can even connect to the My Health record system, it's not, just sort of like a simple process. There is a conformance process, which is quite, detailed, that the system needs to meet these requirements before it's then allowed to access the system. So we have a list of on our website of the systems that are on our conformance register. Each of these systems have gone through a vigorous process to make sure that they are, secure and able to access the My Health record system. So in terms of patient controls and those restrictions that they can add to their record, so there are 2 codes a person can add onto their record. So we have a record access code. This will restrict access to their whole record. Or there's a code known as a limited document access code, and this will limit access to just certain documents within their records. So almost like if you have a house, you can lock the front door, no one can get in altogether, or the front door's open, but then a certain room inside that house is locked. Just one way to think of it that way. And these are the instances where if, for example, a rack has been set and the clinician accesses the record, they will then be met with a message that would prompt them to need to enter the access code, and that's when they would need to ask the patient for that code. Now, this code lasts for 3 years. So once that code has been given, that the whole organization, so it's at the organization level, the whole organization will then have access to the record for 3 years. So they won't need to ask for that code each time, unless that code was to be changed within the 3 years. Now, a person can have the option, as I said, to restrict a document, and they can also remove a document from their record. They can't edit any documents that are there, unless, for example, it was a document they themselves authored. There's also the option for a person to nominate to receive an SMS or an email once their record has been accessed. And there is also an audit log that they can access through their My Health record, again, to check which organizations have accessed their record. And the organizations themselves have an audit log as well that they should be checking, frequently or periodically to check that only authorized users are accessing the system. Now, there are certain, rare situations where if there's a code that's been set on a person's record, where this might be bypassed, and this is in an emergency situation. So we have the what we refer to as the emergency access provision. So again, it is quite particular when this can be sort of utilized. So it needs to be in the instance where the clinician believes that access to the system is necessary to lessen or prevent a serious threat to the person's life, health, or safety, and they're unable to obtain their consent, or in the instance where there's a threat to the public health or public safety. So only in those two instances, then the clinician, again, there's that functionality within the system to click on emergency access. This warning message will pop up just reminding them of the criteria. And then if they proceed, they will then be granted 5-day access to the person's My Health record. And again, this will show up on the audit log. So again, it's recommended that they, have recorded their reasons for accessing the system in their local system as well. And again, so this will give them access to their record as well as any restricted documents that they have restricted, but if they've removed a document, then that's removed, so they can't access that. So an example of when not to use the emergency access provision is in the instance where you're providing care to the patient, you've gone to access their record, they've got a code set on their record and they can't remember the code. So if they can't remember the code, but they're still happy for you to provide that, the episode of care, it's still not a legitimate reason for emergency access. So in that instance, it is up to the person to go back into their MyGov and reset that password. So another example of when not to use emergency access provision is even if you're accessing your own My Health record, or if you're, just practicing, all those reasons are not a good reason. We have a we have a test environment for certain clinical information systems on our website where, more than welcome to play around with those. So here, just to sum up, the functions of My Health record and how these functions will be applied in practice and add value to the workflow. So for example, when it comes to medication reconciliation, so as a pharmacist myself by background, medication reconciliation is really important in terms of making sure that no one is taking, double of a certain medication or something they shouldn't be taking, again, or to help reduce medication misadventure, reduce unnecessary admission to hospitals. So that medicines information view that we saw, that's an ideal source of information to help with medication reconciliation. It saves the number of different, for example, pharmacies or doctors that need to be called to verify a person's information. But again, that option is still there as an add-on if needed. Now, when it comes to assessing a patient, taking their history when they first come in, that's when we said that shared health summary is a great place to start as well. It has those 4 key areas of information. If it's someone that you've just seen after a hospital admission, again, that's when you could source that discharge summary and find out anything that's changed while they were in hospital. those pathology and diagnostic imaging reports being available on My Health Record, it can reduce the number of duplicated tests and scans that are often requested. We see this happen a lot where, you know, the results haven't reached the clinician, so they've then requested this test again, which again, you know, takes more time for the patients, which means they have to then go back again. So this can all again be reduced by having access to those reports. Now we do have on our website as well a list of the pathology and diagnostic imaging providers that are connected and uploading to the My Health Record. So and that's divided by state. So happy to share that link for anyone as well who wants to have a look. And of course, when it comes to end of life care, you know, it's ever planned when someone's condition may deteriorate quite suddenly. So again, having that My Health Record as that platform to have that documentation to then reduce any stress for the family, and then just give the healthcare team that sort of added confidence to make sure they are delivering care consistent with the person's wishes. So again, just to recap, so the security and access policy is definitely a priority to have that done. And then within that policy, you would have determined which mode of access the organization is going to use to access the system, making sure that training's been done. And then what we have is ongoing participation obligations is just all about sort of ongoing responsible use of the system. So making sure that, again, users are authorized, making sure that when you upload information to the system, you know, it's done with your knowledge that this is accurate at the point of uploads. Certainly not discriminating against anyone who doesn't have a My Health Records. What we have here as well is we have the free online training module. So a lot of these are accredited as well. And again, just a great opportunity to familiarize yourself with My Health Records. Yeah, I think that's all I wanted to get through today. It can seem like a lot of information, so I am sorry if it was if it was too overwhelming, but I do hope it was helpful. At any time, like I said, you can reach out to your PHNs for support. You can also reach out directly to us. So we have a My Health Record helpline number. So this is available 24 hours a day, 7 days a week. We also have the help@digitalhealth.gov.au email where you can send us any of your inquiries. We do get to those fairly quickly as well. But otherwise, I'm happy to hand back to David and Yelena.
Thank you so much, Samar. Really appreciate that. Yeah, absolutely. You can contact us at the Adelaide PHN. So digitalhealthinfo@adelaidepHN.com.au is going to be our best contact. We'll email out the slides and also a recording of today's session if you did want to share it with anyone within your organization. But of course, we're also happy to come out on site. We're in Adelaide, of course, so we can provide some one-on-one training or group training to any of your workers if you feel like they would be more comfortable with a face-to-face scenario as opposed to any other training environments. We can also provide, I suppose, that training where you can go through a test environment. So as Samar said, you're not allowed to use the live system as practice, but there's certainly those training environments that will allow you to be confident in its use prior to using it with clients coming in. So yeah, again, thank you very much, everyone, for coming. If you do have any questions, we will hang around for a couple of minutes to answer any of those. So